Kindergarten is the first place where we first start our educational journey. But what happens if it needs to be closed down due to infectious diseases? Children's education journey will be greatly affected as they won't be able to go to school, slowing down their learning process and affecting their learning skills. So, it is very important for us to know, where does this disease come from and how do you avoid catching it? First of all, you can find the hand, foot and mouth disease viruses in the nose, throat, blister fluid and feces of an infected person. And the viruses can be spread under these situations: cough or sneeze, close contact with hand, foot and mouth disease patients, touching the blister fluid or feces of hand, foot and mouth disease patients, sharing eating utensils or personal belongings such as towels and toothbrush, touching contaminated surfaces such as doorknob, switch, and table surface. Hand, foot and mouth disease patients are more likely to spread the virus during the first week of infection. That is why early diagnosis is very important to reduce the transmission. So how do we treat this disease? There is no specific medicine to treat hand, foot and mouth disease. Treatment is usually given to reduce the signs and symptoms experienced by patients. Common medicines are given to treat symptoms such as fever and painful ulcers. Children must also drink regularly to prevent dehydration.
Although this dangerous disease is roaming around,
there is no vaccine available for hand, foot and mouth disease in Malaysia. The EVA71 vaccine is only available in China. Vaccines have saved many lives around the world. The complications associated with vaccines are rare.
And most importantly, vaccines are safe.
There are much more benefits than risk, and with this vaccine, we don't need to suffer from the bad effects of the disease. Parents and caretakers, it is our job to protect the young ones from this dangerous disease. As the saying goes, prevention is better than cure. Now, let's recap on what we learned today. 1. Hand, foot and mouth disease can spread easily. 2. There is no specific medicine for hand, foot and mouth disease. 3. You have to wait for a vaccine that can prevent you from getting sick. Find out on the next episode on what you can do to protect your kids from this disease. See you on the next episode!